And this is a global problem, and it has a huge impact on health of human beings. And so I do believe this is a worthy conversation to have. So in 2004, the World Health Assembly endorsed the World Health Organization Global Strategy on Diet, Physical Activity, and Health. And this was reaffirmed in 2024. And unfortunately, the statistics are not good. You could see in 2024, according to WHO, that adult obesity had more than doubled since 1990, and that adolescent obesity has quadrupled. We know that almost half of the adults age 18 or over are overweight. This is worldwide, and 16% were living with obesity. In the United States, our data is much, much worse, as you could see from this chart. And you could see United States at the top, other countries are significantly below us, but you could see that every country that's listed on here is on a slow or relatively fast uptick. So in the United States, obesity rate has been significantly higher, as I mentioned previously. And we know that it's associated with multiple different medical conditions: hypertension, heart disease, diabetes, musculoskeletal disease, and some of the most common cancers, which we'll talk about in a little bit. The cost of taking care of these individuals is staggering and continues to rise. And it is now estimated to be approximately $173 billion per year. Obesity can begin in childhood and very often does. 90% of children with obesity or overweight at 3 years of age had obesity or overweight in adolescence. The greatest BMI increase occurs between the ages of 2 to 6. So that is an important period for us physicians to monitor and try to positively affect. And not surprisingly large for gestational age babies, where it had the highest rate of overweight or obesity. So that should be discouraged, or parents should be aware of the fact that they need to monitor that weight. This is an excellent review that went over some of the risks in pregnancy. And I think that this is not surprising to any of you, but it's sad. And I think many women don't understand or know that this is, in fact, the case. So there's an increased risk of miscarriage, gestational diabetes, preeclampsia, VTE, having to have induced labor, cesarean section, anesthetic complications, and wound infection. Importantly, women who have obesity or who suffer with obesity are less likely to initiate or maintain breastfeeding, and we'll come to that in a few minutes. The risk for babies is listed here as well, and I won't necessarily read that for you, but I do want to point out the second bullet point, which is intrauterine exposure to obesity is an increased risk for developing obesity and metabolic disorders in childhood because of epigenetic changes that can be caused by inflammatory process that is an ongoing process in individuals who suffer with obesity. The gynecologic conditions, as you can see, are primarily hormonally driven, and I know most of you are familiar with all of this, with the exception of stress urinary incontinence and pelvic organ prolapse, which is more of a wear and tear type situation and increased intra-abdominal pressure. I would like to spend a little bit of time on cancer, because while all of these conditions can adversely affect the quality of life, cancer can unfortunately also end one's life. And so it is both a quality of life as well as duration of life issue. This slide shows you what are some of the primary modifiable factors, and you can see obesity is there, and that's very often accompanied also by unhealthy diet and physical inactivity. So that is important for us to be aware of and stress to our patients as far as maintaining their health. This was an excellent review by De Pergola and Silvestris, which goes over the various mechanisms by which obesity is associated with increased risk of cancer. And they're both genomic, genetic, epigenetic, hormonal, but the biggest player really is chronic inflammation and immunosuppression. So the American Cancer Society in 2019 issued a report specifically focusing on obesity and linked to cancer. And they noted that there's increasing incidence in cancers, while overall incidence of cancers decreasing, increasing incidence of cancers that are related to obesity. And an example also was liver cancer, which previously was linked to hepatitis C infection. Now it's really linked to obesity with steatohepatitis as the cause. The obesity epidemic was first identified in the United States in 1990s. And in this report, the main author, Rebecca Siegel of this report, confirmed that it can often take decades to see how risk factor influences cancer rates. And she stated that we may just be seeing the tip of the iceberg in terms of the effect of the obesity epidemic on cancer. On the right-hand side is a picture from laparoscopy of a patient who had cirrhosis secondary to steatohepatitis. And you could see that sort of lumpy looking liver, not a healthy looking liver. And these are the cancers that affect women that are associated with obesity: uterine corpus, breast, ovarian, and colorectal. Obviously, the others can affect women as well, but these are specific to women in high incidence. Not only is the incidence increasing, but it's also increasing in young people. And the heavier a person is at a young age, the greater the risk that they will develop endometrial cancer in a young age, meaning before age 50. In this graph, uterine cancer is at the bottom of the graph, and you could see that prognosis is significantly worse. Survival and prognosis in patients with obesity is worse. And cancer recurrence rates are higher, as is cancer progression. So it's not just incidence, it's really across the board, has an impact on malignancy. I'd like to spend just a few minutes now switching gears, just talking about surgery in patients with obesity. Minimally invasive approach is generally preferred because of increased risk of infection with open procedures. Scalpel versus diathermia without any differences in infection rates. We know that patients with obesity need adequate dosing based on their weight, and redosing of antibiotics to minimize the risk of infection. Also, to minimize risk of infection, either placement of drains or closure to minimize the depths of subcutaneous layers advised. And these patients need to be watched for postoperatively for obstructive sleep apnea, potentially having CO2 retention while having a normal O2 saturation, and also sedation with lipophilic drugs, which can reinfuse into the circulation. And of course, these women are at increased risk for thromboembolic phenomenon, so prophylaxis is recommended. So how can we integrate this knowledge into some form of action? The American College of Obstetricians and Gynecologists has long ago published recommended weight gain during pregnancy, because at least in adults in pregnancy, I think you have a captive audience and potentially highly motivated individuals who, if they understood what impact the obesity has on them, their own health, as well as their children's health, they would be probably more compliant with these guidelines. However, in the United States, almost half of the women are overweight or obese at the time they become pregnant. The gestational weight gain is higher than recommended in almost half women, and up to 20%, or 1 in 5, of pregnant women experience weight retention of greater than 5 kilograms at 12 months postpartum compared to preconception weight. So basically, we're getting heavier and heavier with each pregnancy, but we also are gaining more weight in between. So an opportunity during the 4th trimester, which is postpartum, is to counsel, and I have it in there 3 times because it's so important, to review the adverse pregnancy outcomes and really focus on impact of obesity on these various conditions, and really frame it in the frame of long-term health for both mother and baby. And then recommending mitigation strategies for patient and offspring. We know babies that are breastfed are less likely to gain too much weight, so that's an important aspect as well of the counseling. FIGO, American College of OBGYNs, and also other societies have guidelines on a well woman checkup. And during this appointment, there's an opportunity to emphasize personalized approach to weight loss, which often takes multidisciplinary approach, and also counseling and prevention to minimize the health risks that are listed here below. And obviously for cancer screening, which may have to happen a little earlier for patients with obesity. This is American Cancer Society Diet and Physical Activity Guideline, and it does include, as you see highlighted there, also contribution by community, by having access to nutritious food that is safe, and also safe outside environments for people to be active, physically active. For those of you who are interested, there was an excellent Netflix special called Blue Zone. And it focused on places in the world where people live beyond the age of 100. And this is diet from Ikaria, Greece, where you could see that really their diet is primarily vegetarian and minimal carbohydrates and minimal fat. Thank you for your attention. I appreciate the opportunity to present to you, and I hope this has stimulated some thought or some action on our parts.